Now, I'm going to be answering questions that patients ask me, and I'm going to try and answer them the best I can. So today, the question of the day essentially is a water fast safe or healthy? So the patient asks, I want to try a water fast to lose some weight, but I heard various things about it, like it's not really good for you, or that you should only do 3 days. What steps should I take if I want to do a water fast? And is it typically safe? So, interestingly enough, water fast goes by another name. The other name that it goes by is intermittent fasting. And I personally have done intermittent fasting back when I was way healthier than I am now. I'm a terrible example, but back then I did really well. And I did it for a period of 6 to 7 days, or I would do it on rotation. So I would fast for 3 days, eat for 1 day, fast for another 3 days, and I would continue a cycle like that. So there's some things to keep in mind. Is it typically safe? Yes, providing you use caution. Excuse me. So there are some things to know. That you will lose weight. And the reason you're going to lose weight from a water fast, which for those of you who are not familiar with either water fast or intermittent fasting, basically it's going a set period of time, depending on the person. They will say, okay, for 2 days, I will not eat any food. I will only drink water. So they do this for an extended period of time, and then they start eating again. What it does essentially is it puts your body in what we call a caloric deficit. So when your body is in a caloric deficit, it's not creating fat. So your body starts eating away that fat, and you start losing weight. So you will lose a lot of weight if you can consistently do this and do it right. That means staying away from sodas. That means staying away from your lattes, your coffees. That's a hard thing, and I'm not sure where you are or if you'll ever see this video, but stick to water. Now, a couple things. It is not without its dangers. And the first one is, surprisingly, if you go, let's use 2 days for an example. If you go 2 days eating nothing and only drinking water, you stand a good chance of becoming dehydrated. Now, you're probably wondering why you'd be dehydrated if you do nothing but drink water. It seems kind of contradictory in terms. Well, this is explained because 20 to 30% of your water intake on a normal basis comes from the food you eat. So the water within the food, hopefully you're eating your vegetables and your fruits. Fruits contain a lot of water. Watermelon is a good example of that. So a lot of its content is water. Cucumbers are the same way, a lot of water content in them. So if you're eating a balanced diet, a lot of the foods you have will have water. So you do that in combination with drinking water, and you're getting your full actual amount of water intake for the day. Now, if you cut out food, you're losing 20 to 30% of your water intake, which could lead to dehydration. And symptoms of dehydration are not pleasant. You've got your dizziness, you've got your nausea, you've got headaches and constipation, but also it could lead to low blood pressure and low productivity. So you're not going to get much done if you're dehydrated. You're going to feel lethargic, you're going to feel tired. So drink more water than you would need normally or normally do. Now, another risk that you should be aware of, and it is very common. I myself had suffered from orthostatic hypotension. Now, orthostatic hypotension is very common among people who do either intermittent fasting or water fasting, interchangeable terms. So let's just call it water fasting, easier to say, and I can move on quicker. So orthostatic hypotension is basically a drop in blood pressure. So it's like you're doing fine, boom, your blood pressure drops. And what happens when your blood pressure goes from a normalized state to a low state very quickly is you get dizzy, lightheaded, and there's a risk of fainting as well. And now with these in combination, you should be very careful, because if you operate heavy equipment, say you're operating a forklift and you stand up to get off that forklift, you do run the risk of fainting, getting dizzy, and it could lead to accidents. So this, again, stay hydrated, avoid operating heavy machinery, and if you experience any of these symptoms, by all means, it's probably not for you. Maybe incorporate a little bit of food, because even if you incorporate a little bit of food, you're still within your caloric deficit, and you'll be able to get stuff done. I have no idea what the hell is going on right now. They're doing some stuff. Now, water fasting also aggravates or increases certain illnesses such as gout. Water fasting increases uric acid production, which causes gout. Now, it also worsens diabetes, type 1 and type 2 if you're interested. If you have chronic kidney disease, it could cause further damage to the kidneys, and that is not a good thing for you. So if you have chronic kidney disease, on the rare chance, please avoid a water fast. And interestingly enough, if you have an eating disorder, you will also want to maybe consider avoiding a water fast as well. There is a little bit of evidence that may encourage eating disorders like bulimia. So if you have bulimia, this may kind of aggravate that. It's a psychological thing. It's kind of out of my scope of practice, but I can say just avoid. Also, fasting may also trigger heartburn, as your body may continue to make lots of stomach acid without any food to digest it. So you have an overproduction of stomach acid, and that'll cause it to just, it's an unpleasant experience for all of us. Now, so will you burn fat and lose weight? Yes. Yes, you will. And it's very popular, actually. There are a lot of benefits to this, as I had mentioned, but there's also a lot of risks. So is it typically safe? Yes. It is typically safe, providing you use common sense. If you're feeling orthostatic hypotension, then by all means, discontinue, relax, get some food, and it doesn't have to be a complete intermittent fast. So what you can do is you can incorporate maybe a little bit of food here, maybe a salad there, and you'll still be fine. You'll still lose the same amount of weight. You just won't feel as bad. You'll feel a little bit better. And as far as length of time to do a water fast, I would say, honestly, 3 days sounds like a good start point if you can handle it. I don't think right off the bat, though, I don't think you should start at 3 days. I think what you should do is do a day, do a 24-hour fast, see how you feel, and then gradually increase it. Go from 24 hours, do a 2-day, go for a 3-day, and if you're feeling adventurous and you've got a lot of experience with this and you know what to look for and you know when to pull back, then by all means go for a 6-day or a 7-day. I would not recommend a month, because it's not a good idea to do it for a month. I would say do it either on rotations like I did, so do 2 days off food and then 2 days on food, or set however many days you want. On my day, I did 3 days in a row, and then I would eat, and then I would do another 3 days without food. And it worked out great for me. I went from 220 pounds down to like 139 pounds, so I did very well. Another thing before I go that I do want to recommend that you know is that water fasting has another unique benefit that I didn't mention earlier, and this one is molecular regeneration. So what happens on a molecular level is that all the cells in your body that have died, once your body is no longer constantly digesting, it now has a chance to clean out dead cells on a molecular level and rejuvenate them with new ones. So cellular regeneration. I mean, you're not going to regrow a limb. I know it sounds cool, but it is very good for you, and the benefits are astounding from cellular regeneration, autophagy. So yeah, knowing that, please proceed with caution, drink extra water, and know your limits. Like if you're feeling tired, pull back. And on that note, have a good one, guys.